Good morning, sir. My name is Dr. Shalini.
Good morning.
So, as far as I know, you are the patient's son.
Yes.
Is it okay if I ask you some questions regarding your mother?
Yes.
Okay. How old is your mother?
She's 75 years old.
74 years old. Is she working?
No, she's not.
So, where do you and your mother live at?
We live in the outskirts of Russia.
So, also I would like to ask you about any complaints that she has been made recently. So, any pains in her body parts?
She has been complaining about pain below her knee in her right leg. First, it's been very mild, but later on it got really intense. It's very sudden.
Oh, it's very sudden.
Yes.
Okay. How about the communications?
She seemed really confused.
Confused.
Yes.
Difficulty in breathing?
Yes, difficulty in breathing for around 2 days.
2 days. So has she had any vomiting?
Yes, she's vomited around 2 times.
2 times.
Yeah.
Okay. Weakness, fatigue?
Yes.
Okay. Yes, she had weakness and fatigue, right?
Yes.
Has she had any fever?
Yes.
Okay, she had fever. So how about her appetite?
She had really bad appetite.
So she had really bad appetite. Okay. I also like to ask you about her past health history. So has she been diagnosed with diabetes mellitus?
Yes, 2 years ago.
2 years ago. Okay. How about stroke?
Stroke 2 years ago as well.
So myocardial infarction?
Yes, from her parents.
Her parents. Okay. Surgery?
No surgery.
Blood transfusion?
No.
Allergies?
No.
Alcohol?
No.
Does she do smoking?
No, she does not.
Drugs?
No.
Okay. Very good. So has she been taking any kind of medications for her pain?
I think Nimesulide.
Nimesulide is the name of the medication,
Yes.
right?
Yeah.
So do you know the dosage?
If I remember correctly, it's 75 mg, 3 mg powder.
Okay. How long she's been taking this medication? Do you know?
Around 10 days.
Around 10 days.
Yes.
What are the indication that she's been having after this medicine?
She had fever.
Fever. Okay. So this medication is prescribed by a doctor, or did she just get it by herself?
She prescribed it herself.
Prescribed it herself. Okay. Thank you, sir. So I will analyze about all these complaints that you have given to me about your mother, and I will come back to you as soon as possible, sir.
Okay.
Thank you. Hello, sir. So I have come back with a conclusion after analyzing all the complaints that you have said. So I have come to a conclusion that your mother has a sepsis in her leg. So for further examination, we will do a further examination regarding her diagnosis. Thank you, sir.
Thank you.
Good morning, Ivanova. I'm Dr. Suzanne. Can you please open your eyes and tell me where you are? Patient is unable to open her eyes and respond to verbal responses. Can you please help me wiggle your hands, please? Patient also lacks motor response. Based on all these, I would give her an 11 points on her Glasgow Coma scale. I'm going to check your head, okay? Head and size of the patient is normal. I'm going to check your eyes, okay? I'll be shining a light on it. The sclera of the patient has a light yellow tint to it, which is an indication of jaundice. There's no edema on the lids. The nose of the patient is normal. The lips of the patient is normal. There's no sign of herpes nasalis or scars. However, there's cyanosis of the lips, which is an indication of poor circulation. The ears of the patient is normal. The neck of the patient is normal. However, the thyroid cannot be checked as patient is unconscious and she is unable to swallow. And then the skin of the patient seems dry, which is an indication of dehydration. The musculoskeletal system of the patient is normal, and palpation of the muscles is painless. The spine of the patient cannot be examined as patient is in a supine position. The temperature of the patient, take it out. And the temperature of the patient is 38.6 degrees Celsius. Patient has low-grade fever.
To conclude the general inspection, patient is in critical condition as consciousness of the patient is altered. The patient has 11 points on the Glasgow Coma Scale. The sclera of the patient is yellow, which indicates jaundice. There could be liver dysfunction, but further tests must be done. The patient's lips shows cyanosis, which could indicate poor circulation due to cardiovascular dysfunction. The skin of the patient is dry, which explains dehydration, most likely due to vomiting and fever. Vital signs of the patient has to be checked further.
The form of the patient's chest is cylindrical. There is no protrusion or intrusion or deformation to the sternum. I'll be counting your respiratory rate for 1 minute, okay? I'm going to put a timer for it. Patient's respiratory rate is 30 beats per minute, which is tachypnea. Patient also shows dyspnea. Now I'll be doing palpation of the chest, okay? I want to check your chest movements. Okay, the chest movements are normal. Vocal fremitus of the patient cannot be checked as patient is unconscious and she's unable to say 99 as I check the vocal fremitus. I'm going to percuss your chest, okay? I'm going to do light taps on it. Okay, thank you. Based on the percussion done, there is clear lung resonance. However, there is dullness felt at the lower parts of the lungs.
Okay, now I'm going to auscultate the respiratory system. Okay, I heard a crackling and wheezing sound in the respiratory system.
Patient has respiratory dysfunction as patient has tachypnea with 30 breaths per minute, as well as wheezing and crackles in the lungs. There is also dullness in the lower parts of the lungs.
I'll be taking your pulse now, okay? Patient's pulse is 120 beats per minute, which indicates that patient has tachycardia. Now I'm checking your blood pressure. Patient's blood pressure is 90/60. Patient has hypotension. I'll be palpating your chest again. Apex beat is felt, but it is weak. Your chest now, okay? Percussion of patient's chest is normal.
Examine the cardiovascular system. The cardiovascular system sounds fine.
Patient has cardiac dysfunction with tachycardia, 120 beats per minute. Patient also has dysarrhythmia. Patient has hypotension with blood pressure being 90/60. The apex beat of the patient is weak.
I'll be checking your oral cavity, okay? The oral cavity is dry, mucous membrane is also dry, but there's no pigmentation, there's no scars, no artificial teeth as well. There's no hernia on the abdomen, no caput medusa, no scars, no strias, and there's no peristalsis of the stomach or intestines. Okay, I'll be doing a superficial palpation, okay, on the stomach and abdomen. Now I'll be doing a deep palpation. I'll be doing percussion of the abdomen. Now I'll be testing for the Bloomberg sign. As for Murphy's sign, it's also negative. Patient did not flinch. The liver will be palpated now. Liver is palpable.
Now I'm gonna auscultate the GIT. The GIT system sounds fine.
I will be performing a digital rectal examination, so you will feel slight pressure, okay?
Upon performing the digital rectal examination, the stool collected showed blood streaks, which is an indication of lower GI bleeding. Patient has GIT dysfunction with lower gastrointestinal tract bleeding and hepatomegaly.
For the inspection of the genitourinary system, there is no hernia, no swelling, no scars, no hyperemia. There is no edema of the eyelids, and the inspection looks normal. I'll be palpating your kidneys, okay? Placing my hand here and palpating. Palpation is normal. Percussion cannot be done as patient is lying in a supine position. And in this case, Foley catheter will be advised as the urine output of the patient has to be monitored.
Patient has normal genitourinary system, but Foley catheter had to be inserted into patient to monitor for changes in the urine output. With that being done, the urine output of the patient is checked and has shown reduction. The locomotor system of the patient shows weakness of arm and leg of the left side due to hemiparesis 2 years ago.
Hi, I am going to check the local status on the patient's leg. Hello, my name is Dr. Mira. I'd like to check your leg. Is that okay? Okay, thank you. Firstly, I will do the inspection. So right now, I am going to do the inspection. So as we can see, that the patient's right leg have blackish discoloration of skin, while the left leg is normal. There is no presence of the varicose vein for both of legs. So if there's presence of the varicose vein, it will look like this. Next, I also noticed that there is muscle wasting on the right leg. The infection site is located here, shows that the patient have ulceration from the gangrene. So she have the wet gangrene. Now I am going to do the palpation. First, I will try to find the pulse on the femoral artery. The right femoral pulse is absent. The right popliteal pulse is absent. The posterior tibial pulse for the right leg is absent. The dorsalis pedis pulse is absent on the right leg. Now I am going to check the temperature for both of the legs.
The right leg is cooler than the left leg. This is maybe due to the absence of pulse, so it feels cooler than the left leg. Now I am going to check the sensitivity of the skin on both of the legs. So the patient feels numbness on the right leg. There is also no sensitivity present on the right leg. Next, I am going to check the capillary refilling time on the right leg. Firstly, I will press the thumb until it turns white, and then I will calculate how many seconds till the blood refilling back to the thumb. So this patient has capillary refilling time more than 3 seconds. The patient also experienced loss of tenderness on the right leg. Now I am going to do auscultation on the patient. I will auscultate on the left carotid artery, right carotid artery, left subclavian artery, right subclavian artery, abdominal aorta, left femoral artery, right femoral artery, and superficial femoral artery. There are no bird sound at any point. In conclusion, from the local status examination, we have found that the patient has wet leg gangrene on her right leg. This is due to the blackish discoloration of skin, presence of the muscle wasting, cool temperature, slow capillary refilling time, numbness, sensitivity is absent, and also there are no pulse present, which are at the femoral, popliteal, dorsalis pedis, and posterior tibial arteries. So these all are indicators for the patient is having a peripheral arterial blockage. Now, I am going to do the swab test by taking a little amount of the pus on the infection site. The sample will be sent to the lab to check what kind of microorganism on the infection site and also the sensitivity for specific antibiotics, which may be useful on the treatment given to the patient later.
Hello doctor, what is my mother's condition?
Hello, so after we did the subjective and objective examination, we can make a primary diagnosis on your mother that she had a wet leg gangrene on her right leg. This is also accompanied by our examination. We have found blood during digital rectal examination that shows that your mother have lower gastrointestinal tract bleeding, and also she has severe sepsis because we have found indicators for it, which are tachypnea, rapid breathing, tachycardia, high pulse rate, hypertension, low blood pressure, and also dehydrated from her dry skin.
So what will doctor do now?
Okay, as for now, we cannot give further treatment plan on the patient. We have to do further investigation on the lab and also instrumental. So after we get the result from the lab and instrumental diagnosis, we will then make a planned treatment for your mother. Is that sounds okay?
Okay.
So you need to wait approximately about 30 minutes or more. So during that time, you have to be patient as we will try our best to treat your mother. Do you have any question?
No.
You will meet another doctor that will assist you on explaining about the lab and instrumental diagnosis with expected results and also the final results that we will obtain later. Okay? That's all.
Thank you.
Hi, I'm Dr. Naveen. Today I'll be doing lab and instrumental tests for our patient. I'll be doing ECG, CT scan, ultrasound and X-ray for our patient, and I'll be also doing urine analysis and blood analysis for our patient. It will take around 30 minutes to 1 hour, and I'll let you know once the reports are ready, and I'll call you and explain completely about the patient's report.
Okay, sure, I'll wait.
Now I have the complete findings of the patient. So I'll explain one by one. I'll begin with chest x-ray. Okay, this is the chest x-ray of our patient. We observe that the patient has bilateral peripheral consolidation and venous distension in the upper lobe and interlobular septal lines due to left ventricle failure. And then you can observe these septal lines over here. Our patient has pleural effusion on both sides of the lung, as you can see, and increased hydrostatic pressure, edema. And here you can observe that our patient has a bat wing shape, like here, it's a bat wing shape, which is usually due to low pressure pulmonary edema. Okay, here now we have ultrasound scan of our patient's liver. This is our patient's liver, and this is a normal healthy person's liver. Our patient has acute hepatic dysfunction. Our patient's liver cannot perform the basic function. Our patient's liver has been compromised. Okay, so now we have the ultrasound scan of our patient's kidney, and this is the normal kidney of a healthy person. Our patient has renal failure, that means kidney failure. So our patient's kidney has been compromised and it doesn't perform any basic functions. Okay, now we have the ultrasound scan of our patient's pancreas. Our patient's pancreas has dysfunction, and this is a normal healthy person's pancreas. Okay, as you can see here, this is the ultrasound scan of our patient's gallbladder. This is our patient's gallbladder, and this is a normal healthy person's gallbladder. Our patient has gallbladder dysfunction. This is the ECG reading of our patient. Our patient has arrhythmia. Arrhythmia means irregular heart rhythm. And now here we have the CT scan of our patient's lower GIT, and this is a normal healthy person's CT scan. You can see the organs are in a perfect and healthy manner, and our patient's lower GIT has bleeding, which means our patient has internal bleeding in the lower part gastrointestinal system. So here you can compare yourself, and this white patch is known as the bleedings, like here you can see, observe here. These are the internal bleedings of our patient. Okay, now we have the lab results of our patient. As you can see, here is the normal results, and this is our patient's result. As you can see here, the RBC level is low because the reasons are the internal bleeding in the lower gastrointestinal system. And as you see, the WBC, neutrophils and lymphocytes, these are the main primary immunity of our body, but due to severe bleeding in the lower GIT, our patient's immune system has been suppressed, which means our patient is prone to infections very easily. And okay, now if you look at the bilirubin, glucose, AST, ALP level, our patient's results are higher comparing to the normal because our patient has liver dysfunction. And now if you look at the urea, protein and plasma urea level, the urea and plasma urea level are higher and protein level is low. Now if you look at the hematocrit and hemoglobin level, it is low in our patient's body, mainly due to the lower GIT part bleeding. Hematocrit and hemoglobin levels are supposed to be high, and it is supposed to be in the blood circulation system, but it is in the lower part of the GIT, which is not supposed to be there, which is not good for our patient. And now if you look at the INR, it's high in our patient's body, which is basically due to the lower GIT bleeding. And now if you look at the oxygen level and carbon dioxide level, the oxygen level is low in our patient's body due to arterial hypoxia, which means our patient doesn't have sufficient blood in the arteries. That causes increase in the concentration of carbon dioxide, which is not really good for our patient. And in the urine analysis, we have found that our patient has glucosuria. So these are the findings from the lab and instrumental investigation, and these results doesn't look really good for our patient. So for the further final diagnosis and final conclusion, I'll refer you to Dr. Atira. She will explain you with the final diagnosis.
Okay, thank you. I will consult Dr. Atira.
Hello, my name is Atira. I'm one of the doctor.
Hello, Dr. Atira.
So basically, we have done a pretty urgent instrumental examination, and we also done a laboratory examination such as complete blood count test to confirm our diagnosis. It has shown that he's had what we think is an arterial thrombosis, and he just seemed to have multiple organ dysfunction syndrome, as we noticed that he has respiratory, heart, liver, gastrointestinal, renal, central nervous system and hematologic dysfunction. Do you have any question?
What is arterial thrombosis, doctor?
Arterial thrombosis is a blood clot in an artery. It can be very serious because it can block blood from reaching to the important organ.
I don't get it, doctor. How can my dad got the so-called arterial thrombosis?
Your father got the arterial thrombosis due to the cardiac dysfunction that we had found from the examination that had been done. As we know, he had a past history of myocardial infarction. So, the thrombosis can form in this situation and go to systemic circulation, then block the peripheral arteries in the leg. In addition, he also had history of diabetes mellitus, which may complicate the situation.
It sounds very serious, doctor.
Yeah, at the moment, he's quite unwell. I know, this must be really hard news to hear. Is there anyone you want to call or you want us to talk to?
I kept thinking, who can I call? I don't want to tell anybody because it's just too much for everybody.
Oh, it's okay. We can be here to be your support. If you do like, even though we are not relative or friend, but we can be, okay? And I'm quite happy to sit with you if you let me to.
Is he gonna be okay?
He's gonna be okay. We are going to be with you every step of the way. Your job just to be doctor and I will be the surgeon, okay?
Alright, doctor. Thank you.
I know, that's a lot to take in. But would you mind if I tell you a little bit about the plans going to be, what we are going to do the next step is, so we can keep taking good care of him.
Yes, please, doctor.
Hello Wilson, I'm Dr. Shireen and I'm going to be her doctor for the treatment process. She's going to be okay. Few things you should follow during the treatment and I'm going to explain you, okay? Okay. She will have to be in supine position in which right now she is. And she will also have NPO diet, which means cannot have food or drink from mouth. And she cannot do any physical exercise. You should take care of it, and we will provide such medicines to speed up the recovery. Okay, and we will provide her some medicines. We will administer like non-steroidal and anti-inflammatory drugs, and we will give her oxygen therapy treatment, infusion therapy treatment, oxygen therapy, and inhalation therapy, bronchodilator, and antiseptics. And we will provide her also respiratory therapy, includes deep breathing exercises, etc. And for the surgical treatment, we need to insert urinary catheter, and we need to monitor the urine output, and we will check the respiratory rate, PaOS, and CO2 monitoring time to time. And we will use central venous line and administer oxygen therapy and mechanical ventilation. And the patient will be needed packed red blood cells as for the correction of anemia. And we will also give an FFP, cryoprecipitate, and platelets to correct her hemostatic system. And we will use and insert nasogastric tube to the patient for carries food and medicines to the stomach through the nose. Okay. Do you have anything to ask? Okay. Is everything is clear for you? Okay. So don't worry. She is on good hand, and she will be monitored from time to time, and she will be recover very soon. Okay.
Doctor. Good morning. Your child is diagnosed by leg gangrene and surgery is the only way to save his life. Okay. So we have to amputate his right leg above the knee as soon as possible within 2 hours.
Okay, doctor. Is there any risk of surgery?
Yes, the risk of surgery is high, but this is the only way to save his life. We have also the risk of thromboembolic complications and high risk of bleeding complications.
Okay.
Are you ready for the surgery?
Yeah.
Okay, so sign the informed consent. Thank you. I have checked the vital signs of your. His temperature is 38.3,
Okay.
his pulse is 120, and respiratory rate is 30. His blood pressure is 80/50, which is quite low.
Okay.
We have arranged for his blood, and for now he is on NPO diet, so no enema is required. We will insert nasogastric tube.
Okay.
We have given pre-anesthetic medications, and we are giving local anesthesia because general anesthesia will suppress his respiratory system. We have made sure that his oral cavity does not have any any foreign bodies, to avoid fixes, and we have already started infusion therapy. Any
Okay,
other update, I will let you know. Nurses have removed all types of accessories which is on the patient's body, like jewelry, piercing, etc. Normal saline solution is administered between 12:30 to 1:30 p.m. amount 758 ml. Dexter 5% solution is administered between 12:30 to 1:30 p.m. 500 ml. Linger Ractate solution is administered at 1:30 p.m. 750 ml. RBC is administered at 1:30 p.m. 500 ml. Fresh frozen plasma is administered at 1:30 p.m. 500 ml. Platelets are administered at 1:30 p.m. 250 ml.
Surgery was carried out to amputate the right leg with wet gangrene above the knee, and here is a video demonstrating the procedure. This is the surgical amputation report, which contains the steps performed throughout the surgery. During the surgery, the anesthesiologist constantly monitors the patient's vital signs, infusion rate, and the urine output. Based on the intraoperative monitoring chart, the patient's vital signs remain stable throughout the surgery. The urine output of the patient was also measured with a Foley catheter and has improved during the surgery. Infusion therapy is still continued intraoperatively to replace lost blood, fluid, and electrolytes during the surgery. Crystalloids, colloids, and blood products are administered to the patient, as you can see from the chart. During the surgery, the patient was administered empiric bacterial therapy intravenously, which includes carbapenems and vancomycin.
The patient came out from surgery, and currently I would like to collect some vital signs of the patient. First of all, I'm going to collect the blood pressure. The blood pressure of the patient is 120. Now I'm going to collect the pulse and also the temperature of the patient. patient's pulse is 90 beats per minute and the temperature is 38.3. The urine output of the patient is 50 ml. Now, I would like to draw some blood to carry out some lab testing.
As we can see from this table, the patient after surgery has a pulse of 90, respiration rate of 20, systolic blood pressure of 100, and the temperature is 38.3, meaning the patient still has fever. The volume of urine output is 50 ml. The patient is put on NPO diet, placed in supine position, and the medications given are third generation cephalosporin, metronidazole, insulin, which is given intravenously, ibuprofen, and heparin for prophylaxis of thrombosis. Here, we could see that cephalosporin and metronidazole was given after surgery at 3:30 p.m. 1 hour later, ibuprofen was given intravenously, and then at the next hour, heparin was given, along with albuterol and betadine. At 6:30 p.m., insulin was given intravenously. Lab testing was done with the blood collected. We could see that red blood cell level is low due to hemorrhage at the lower part of GIT. Leukocyte level is also low due to the suppression of immune system and bone marrow. Also, the intoxication is so bad that the body could not cope and react to it. Creatinine level is high, which suggests kidney dysfunction, and bilirubin levels are high, which is due to liver dysfunction. Hematocrit level is low, so we could suspect that anemia is present.
I'm very sorry to inform you that the patient's condition is getting worse and worse every hour. We have been monitoring the result very closely, and we are planning to change the treatment plan. We are going to change the antibiotics and also increase the infusion rate. We hope to see improvement soon.
Second day, we could see that the pulse has increased, the systolic blood pressure decreased, and the consciousness of the patient is getting worse and worse over time, but the temperature remains the same. The urine output decreases and eventually reaches anuria. We could safely say that the patient's condition is deteriorating.
Sorry to inform you that we have tried our best, but unfortunately, some complication occurred. This complication has affected other organs, leading to multiple organ dysfunction. The time of death of the patient is 4:15 p.m. I'm sorry for your loss, and do let us know if you need help with anything.